The high rate of maternal mortality in Africa, especially Ghana, is attributed to social factors such as lack of access to medical care for expectant mothers, as well as superstitious beliefs. These challenges, more often than not, cause delays, resulting in complications and death.
We are in the delivery room now at the Hollywood Teaching Hospital. And this woman who is lying here is being prepared for delivery. These are some of the things women go through, and these are some of the things matrons had to go through to get babies delivered safely.
I see a woman every day in the mirror. I see a woman, and every time I look at mama, I see the woman, a wonderful woman, and a friggin' woman, mother of nature, beautiful woman, beautiful woman.
In many countries, when a woman goes into labor, she says goodbye to her family because she knows how dangerous childbirth can be.
In Ghana, in Africa, very many women die from pregnancy-related complications. Nobody should die giving life. It's an infringement on the fundamental rights of women.
Even to the man who thinks that pregnancy is not a disease and therefore you shouldn't mind the woman, why is she behaving as if it's such a big thing? It is a big thing because it is life. Life of one yet unborn and the life of the one carrying the unborn child.
It's rather unfortunate that when women are pregnant, they only get information when they go to the antenatal clinic. But reproductive health and childbirth information should be everywhere. It should be so accessible. People should be adequately informed and well informed before they even get pregnant.
Once there's a baby, you find some movement, and then sometimes you vomit. Other times too, you feel cold. A whole lot of symptoms, headache and what else.
The World Health Organization, WHO, says about 1,000 women die from preventable causes related to pregnancy and childbirth around the world every day. According to Amnesty International's report for 2010, nearly 65,000 women nearly died in pregnancy-related conditions in 2004 and 2005.
The leading cause of maternal deaths in our country and in most developing countries is hemorrhage, bleeding, massive bleeding, either before, during, or immediately after delivery. Deaths from ectopic pregnancy, abortions would all constitute maternal deaths.
Approximately 16% of the reported maternal deaths were due to preeclampsia and eclampsia.
As a country, this is the second most important cause of maternal mortality. And so it's a very significant condition. Unfortunately, it's a condition that cannot be completely prevented, but we can detect it early and nip it in the bud before it becomes a complication, and that is where the hope for the nation is.
Experts review that preeclampsia is a condition in pregnancy characterized by high blood pressure, sometimes with fluid retention, while eclampsia is where one or more convulsions occur in a pregnant woman, alongside pregnancy-induced high blood pressure, often followed by coma, thus posing a threat to the health of mother and baby. Estimates by the UN Population Fund, WHO, UN Children's Fund, and the World Bank indicate that developing countries continue to account for 99% of all maternal deaths in sub-Saharan Africa, with South Asia accounting for 87% of the global figure. Sub-Saharan Africa recorded the highest of 640 maternal deaths per 100,000 live births in 2008.
So it's very important for the men to also be part of the process of making sure that we give them the bouncy baby boys and girls that they are so proud of. They'll go and do an outdooring. This is my child. This is my child.
But I do say me baha no my sister na ya odi me baha. Ama me baba odi ono na di me baha. Ansana. Omuje me to.
People die exactly while the husband is lying in a hammock, relaxing. So the gap between the ability to access a health facility and themselves is like a mighty ocean. So they are seeing the clinic far away. How to cross to get to the clinic is the problem.
What has been your support for your wife throughout till now that we are seeing her at the hospital?
Well, since from the day she conceived, I've been supporting her from the house to hospital. And then, as you've seen now, I'm helping her to carry the baby for her to pass through the normal check-up system.
Countries including Ethiopia, Nigeria, Sudan, Kenya, DR Congo, Tanzania, Afghanistan, Indonesia, Pakistan, and India has 65% of all maternal deaths the same year. In the UK, maternal mortality and morbidity ratio is 8 per 100,000 per live births. According to a 2010 joint report by the United Nations and the government of Ghana, 450 mothers died in Ghana per every 100,000 live births.
We give them prophylaxis and educate them on how to prevent malaria in their homes. Because when a pregnant woman gets malaria, it's very serious. It affects both the mother and the baby. She may either lose her life or lose the baby.
There are delays in seeking care, delays in reaching care, and then delays in receiving care at the health facility. At the rural level, you find that because of poverty, ignorance, problems of distances between homes and health facilities, poor infrastructure, poor transportation, perhaps husband is gone to the farm or is gone fishing and doesn't come back. He's got to provide the finance.
It is reported that 94% of pregnant women in rural areas seek antenatal care from a health professional, but less than half deliver in a health facility, hence causing deaths should there be complications. However, the ratio differs across the regions and by locality.
By the 2008 Ghana Demographic Health Survey, the ratio of women, or the percentage of women who are using the health institutions for delivery currently is 59%. That is a little bit more than half, 59%, and the remaining 41% still deliver outside the health system. But we must also remember that the health institutions have not improved in their capacity over the years. With the current state of affairs, even the major institutions within the metropolis, and for that matter some other areas, are experiencing congestions. So we even wonder if all the women come to the institution, how the situation will be.
If your wife is pregnant, she didn't choose to become pregnant. It's a joint decision, you know, and so she has to be assisted in whatever way possible to make her deliver safely. The problem of maternal mortality is not just men's problems or women's problems. No, it's community governance, men, women. All of us put together.
We need to train more physician assistants. We need to train more nurses, maternity nurses. We need to find very creative ways of ensuring that where it is difficult to have this access, people can reach them.
When you look at the trends, even though there has been significant improvement and there continues to be an improvement, we might not exactly meet the target, but we will have gone significantly very far.
I pray not. What you're doing shows that there's a certain awareness that we are not quite there yet, and that there are things that need to be done. And I think with voices like yours and so on, we should be able to meet it.
If not at all, we have to reduce it.
Mind you, maternal deaths are the second leading cause of death of women between the ages of 12 and 49 in our country. So we've got plenty of work to do before the year 2015.
I tell you in confidence, that police hospital, we are ready to meet the MDGs. God Almighty being our helper.
I have been talking about eliminating, because no woman should die when a woman goes to give birth. Pregnancy is a continuum of the process of being a woman. When a woman ovulates, she doesn't die. When she menstruates, she doesn't die. So why should she die when she goes the next step in her reproductive life to conceive and to give to have a baby? I think that if we put our hearts to it, we'll be able to go a long way in 2015.
Throughout the country, midwives are working tirelessly to reduce maternal death and improve the health of women and newborn babies.
First, when they report, we do scan to confirm the pregnancy, and then they do various lab investigations. And then we educate them on when they see any bleeding, they should report to the clinic. We check their BP, weight, and then urine to prevent any complications.
We don't forget to educate the adolescents about preconceptive care, because pregnancy is a whole ball game altogether. You must know what you are going in, because changes will come psychologically, physically, economically. How empowered are you to take care of that pregnancy?
Here we normally admit complicated cases. Patients who have problems like those with high blood pressures, those with losing lipos, and then bleeding in pregnancy. This one, for example, she came in with losing lipo. We set up syntocinon drip on her so that we can have contractions and then she deliver. And listen to the fetal heart rates, checking how the baby is faring.
Successive governments have made efforts to slow down the rate through the enactment and implementation of policies, legislation, and services. In 1987, Ghana accepted the Safe Motherhood Initiative launched by the WHO and other UN agencies like UNICEF. 1998 also saw the government of Ghana introducing free antenatal care to all pregnant women, and in September 2003, a policy of exempting all users from delivery in health facilities was introduced. Thus, financial barriers to using antenatal and delivery care in public and private health facilities were removed.
In 2007, there was a survey which we call Maternal Health Survey, and this survey came out with a figure of 451, which was a figure we've been using in official circles. Then in 2008, WHO, doing some estimates in Ghana, came out with a figure of 350 per 100,000 live births. So as far as Ghana is concerned, these are the official figures. And by these figures, you will realize that there has been an improvement in the situation in Ghana.
With these efforts being made, all stakeholders, including health professionals, must complement government's efforts by putting up their best, including the right attitudes to offer quality health to mothers and the babies to guarantee safe motherhood in Ghana. With access to essential maternity and basic health care services, nearly 80% of maternal deaths are entirely preventable.
Bobby.
meeting the Millennium Development Goal that still lags behind, new data and methodology indicate a much more progress than previously thought in reducing maternal morbidity.
We need to also tackle the emotional, psychological, mental, and spiritual aspects of pregnancy. It is high time that we bring human rights issues into pregnancy and childbirth issues, into reproductive health issues, so that pregnant women will be confident enough to choose wherever they want to give birth.
The more important thing is, where is my history kept? Who has been taking care of me ever since I became pregnant? Who knows enough about the other conditions of mine to be able to help? It means that where I'm going should also have good facilities where I can give birth, you know. I think sometimes when you just talk about human rights, you can lead people astray. I have the human right, you know, I'm living in Fanchinebra. That's where my history is. But I've heard that there's a hospital in Tema, which has all the things. So I'm going to travel all the way from Fanchinebra without a file, and I'm going to go to this doctor. He doesn't know a thing about me, and he's supposed to deliver me. It's my right. But isn't that a foolish right?
According to Eve's Foundation, an NGO committed to providing adequate and effective information, education, and counseling on reproductive health, if we are to heal this planet, then we must begin by healing birth. Rebekah Awuah reporting.